Dr. Łysek,
Hi, hello to everyone.
so today I would like to ask you what to do if my teeth are sensitive.
Oh, it depends of the situation. Teeth are normally very sensitive when you eat something cold or drink cold water.
Mhm.
Then you may feel a sudden pain, but when your teeth are or generally roots are uncovered,
Mhm.
then there is a problem, and the best way to solve it is to go to a dentist and find a solution. So, if you feel a sudden pain just sometimes when you when you drink something cold or eat ice cream, let's say, it's okay. But if it happens very often, then you have to go to a dentist and find out what's the problem.
Mhm. Can this sensitivity ever heal on its own?
Uh, Generally, no. Teeth are normally sensitive, as I told you before. But if there is a bigger, deeper problem, I mean, a tooth is cracked, there is a caries lesion, or roots are uncovered, then you can't help yourself, and it won't stop just because you wait. You have
Mhm.
to go to a dentist.
Well, when using sensitive toothpaste, can this also help the situation or not?
Uh, yes, of course, the toothpaste was generally designed for this problem,
Mhm.
and you can use it to help yourself with this sensitivity. But still, it depends what's the source of the problem, and when it's sometimes uncovered root or just normal sensitivity, you may use a toothpaste for sensitive teeth. But if there is a deeper problem, then at first it may help, but the core problem persists, and when you wait, you will have a bigger problem in the time.
Mhm. For example, sometimes I'm brushing my teeth too hard or I'm using like a medium toothbrush.
Okay.
And can brushing like my teeth too hard also cause sensitivity?
Yes, of course. Normally, we recommend using a soft or very soft toothbrush because what stays on our teeth after eating is it's a very soft, thin layer of let's say, food debris,
Mhm.
and we can normally remove it with a soft toothbrush.
Mhm.
No need to use a hard one or a medium one as well.
Mhm.
So when you use a hard toothbrush or you're doing it very frequent and with a very uh, you know big force, then you may damage your gums and they will recede, and you may have a problem with bleeding, with recede gums and uncover roots and uh, sensitivity as well.
Mhm. What can we expect when visiting the dentist with a sensitivity issue?
At first, we make a general examination and try to find out what's the problem. Because, as I told you before, the sensitivity may come from, of course, the main cause is uncovered roots, but it might be also a cracked tooth, a caries lesion, a wear tooth. So, at first, we examine all your teeth, make an x rays, and try to find out what's the reason of this sensitivity. And if it's very simple and your teeth are generally healthy, then we just recommend you toothpaste for sensitive teeth. If the gums recede and roots are uncovered, we can make some little surgery or cover these roots with some special material, and it may help. And if there are these other issues, then we have some specific treatment for that as well.
Okay, last question for today.
Okay, thank you.
Is there anything I can do or that you can recommend for our audience to do to prevent tooth sensitivity?
Pardon, once more?
Yes. Is there anything that you can recommend for us to do to prevent tooth sensitivity? For example, like everyday eating or drinking, things to stop.
Okay, of course. Sensitivity is mostly caused by acids. So when you drink, let's say, apple juice or orange juice, then your teeth may become sensitive, and you may stop drinking these juices or some artificial drinks, carbonated, like let's say
Coca-Cola.
Coca-Cola, maybe. But on the other hand, when you're drinking those beverages, then don't brush your teeth just immediately after drinking, because you remove a surface of the enamel, and it may raise a sensitivity. So that's the main thing you can do for your teeth. So just stop drinking acidic beverages, drinks.
Okay. Thank you so much.
Thank you very much. It was a pleasure for me.